All right, full disclosure before I get into this. Jace Medical is a sponsor of, are you just Blaze? You're not radio too, right?
Not yet.
Yeah, okay. I talked to these guys a year ago, and they had what they put together was the JASE case, and it has 5 different antibiotics in it. And I thought that was really great because as we were talking, I said, my daughter takes anti-seizure medication. I'm on high blood pressure. And if you know anything at all about when the system breaks down, your antipsychotic drugs run out in 30 days. Your blood pressure, your anti-seizure, all the things that are keeping people alive that probably wouldn't have been alive, a few years ago, they all run out in 30 days. Where are you going to get that? That's the question I asked you guys a year ago. And you said, we're working on it.
Right.
So let me bring in Dr. Shawn Rowland. He is the founder and CEO of JASE Medical. What are you bringing?
Well, as you mentioned, it was a year ago. We've been working on this for a while.
Yeah.
Bringing to market the antibiotics, knowing that was just really the first step, and a very important step, a vital step. But to your point, everyone's out there dealing with different personal conditions. Mm-hmm. And so finding a way to do our same service with the JASE case, which is our antibiotics, being able to do the same thing for chronic conditions. So we're super excited. We're here to let everyone know that they can now go to jasemedical.com. They can get access to up to a year's supply of their whatever chronic medication they take. Blood pressure, thyroid, seizure disorders. There's quite a list.
How expensive is it to buy a year's worth? I know my daughter's medication for her anti-seizure is like $700 a month. It's something outrageous.
Yeah, so that's a really good question. It's so dependent on the actual medication you're taking. Some of them are pennies, some are not. And so really it runs the gamut. But what we've tried to do is basically make it as accessible as possible. But it's not just the medications you've got to pay for. You've got to pay for the physician visit, to have that encounter, to get the prescriptions, and then go to the pharmacy, get your prescriptions, and have them sent out. So packaging that all together, it turns out though that it's probably a lot more accessible than people realize, just because we're so used to dealing with insurance companies and co-pays, and we were just disconnected from the true cost of the care we receive. And so we kind of have taken all that out and made it a much more direct connection between ourselves, the patient, and the physicians.
So you put together a list here, and I don't recognize any of these drugs. I bet I'm on one of them. Fluoxetine. Isn't that anti-depression medicine or not?
Yeah, that is one.
And a 12-month supply is $60. That's great.
Right. Yep. There's some on there that it's $40, $50, $60. You mentioned some seizure medications; those might get up there a little more too.
Yeah, I'm sure.
And right now, this is limited to pills, tablets, for the most part. So injectables aren't yet on the list. Insulin, which is a big request that we get, and how do you solve that problem for insulin?
How do you solve it? How could you even store it for a year, though?
So if it's stored properly, you can in some cases get up to a year of viability out of your insulin.
Wow.
As soon as you take it out of the fridge, it kind of the clock starts ticking, and you get your 30 days or whatever it is. So there is a way to do it, and that's something that's another one that maybe we can come back and talk about. But that's another one that's in the works.
Right. And how are you? I mean, because the government is so freaked out about every kind of pill now, and they're cracking down on everything, and they're creating all kinds of problems and shortages and everything else. But do you have to have your doctor call in to you guys, or what do you do?
Right. So the biggest thing, bringing up kind of regulations, and our goal, we want to empower people, and we want to do that through access to physicians, access to the medications at a reasonable rate. And part of this, though, is not everything's on the table. It's not everything's an appropriate or safe option. So, of course, controlled substances, just an immediate off the list. There's no way I can get you a year supply of your ADD medication or your pain meds. And so there's certain medications that are just disqualified right off the bat. So that's it's appropriate. It's the best way to do it.
Yeah.
We're talking about
that would cause you all kinds of trouble.
Yeah, and it would, and I think again, trying to balance access and empowerment with appropriateness is also really important for us. And so, when it comes to the controlled substances, that's just something that we're not able to help with right now. Again, though, coming up with got some things in the works there. So really, we're talking about the legacy drugs. These are you've been on your blood pressure meds for 10 years.
Yeah.
You see your doctor regularly. Things are under control. You haven't changed your dose. You're a safe patient. You're someone that I as a physician would feel comfortable knowing that you've got regular follow-up. I'm going to give you a year's prescription for this medication, and why not? And that can be applied to a lot of different medications and conditions. And they're all relatively, I'm going to say, low risk when you compare them to things like opiates and things. So that's where kind of regulatory-wise, it goes through a board-certified physician licensed in your state, goes to a pharmacy that also is licensed to do business in your state as well. And so,
and the JASE case has 5 flights of antibiotics?
Right. So you've got 5 antibiotics in there, covers really quite a range of different potential bacterial infections. They were specially curated and selected because of the things they cover. We want to cover things that are common, that might be common in a scenario where you don't have access to medical care. Things like UTIs, urinary tract infections or sinusitis or pneumonia. We also want to cover things that are really deadly, like a bioterror attack. If there was an incident of bioterror in your city, some aerosolized anthrax, which is one of the agents that's been identified by the government.
Plague
is another one.
They're using. Exactly. And don't worry, anybody. Just in China, the same lab, they're just doing some experiments with the lab. With the Black Plague, and should work out fine. It'll be fine.
Well, so there is treatment for that, and prophylactic treatment that everyone would need to be on. For example, one of the drugs that are in the kit is doxycycline. So the idea is that you'd get the whole population taking prophylactic doxycycline in the event of one of these attacks to prevent getting sick, right? And so how that gets from the national stockpile into your hands as a citizen in whatever city you're in, I'm not sure how well that's going to go. We kind of saw how the vaccine rollout went, and things like that. Probably, and it needs to happen within 24 hours. So probably not going to happen.
Yeah.
So that's one of the ones we include, and we include it in an amount that would be appropriate for you to take, which is 2 months. You've got to take that medication for 2 straight months.
And that's in the JASE case?
And that's in the JASE case.
Wow. I didn't know it was 2 months.
Yeah, it's a long prophylactic.
And can you get it for each member of your family?
So, and this is another one where we need to operate within these appropriate bounds. And so right now, this is for
one.
It's for one person because it's got to be prescribed to that person through the physician. And then age-wise, we deal with basically it's adults. But if you've got a minor, if you've got a child that's 14 or older in your family, they're basically going to be taking adult doses anyway. Mm-hmm. So we'll do it for 14 and older as well. Mm-hmm. So it does leave a big portion when you're talking about pediatric patients and those that are younger. And so that's another one.
I have to tell you, this is you guys are you guys preppers?
Well, I'm going to say yes. I guess preppers is like everyone. There's such a range of who's a prepper, right?
I know. Let me just say this. You're worried about the supply chains. You're worried about things.
I could sit here for the next 3 hours and talk about the dangers, the razor's knife edge that we are on. That is at its core why I did this. Is because of that, because of living through pre-COVID, being in a hospital, in a community hospital, and dealing with shortages at that time, which was, for me, just like, what is going on? How can this be?
We stopped being the America I know during COVID for multiple reasons. But one, I remember people saying, well, we're out of that. We won't have it for maybe 6 months. And I'm like, what do you mean 6 months?
And that might work for the computer chip in your car. You can get a car, you just won't have all the fancy thing. Or maybe you can wait a year for your stove to a new stove to install. But that doesn't work for medications.
And if we go to war, if China even just does a trade war with us, don't they make like 18 different ingredients that we don't have access to? Like most of our drugs.
At least. Yeah. All roads lead back to China when we're talking about pharmaceutical supply. Even when you look at factories in India, for example, which is another big supplier for the world, not just for the United States. We're in line with everybody else. For the world, turns out, and this happened over COVID actually, India's government came out and said for the first time, because these are numbers that are really hard to find. The FDA can't find them. And the government's trying to figure out how can we get more transparency in the supply chain. India came out and said that around 70% of their active pharmaceutical ingredients for their manufacturing process come from China.
Oh my gosh.
So again, kind of all roads seem to lead back to China. Certainly when we talk about generic medications, which is 95% of what we take in the United States on a daily basis, are generic medications. Virtually 100% of those are produced out of the U.S. and mainly have some tie, whether it's an ingredient or outright manufacturing in China.
Well, it's good to talk to you. I'm interested to see how this is all going to work out. I want you to go to and this is not a commercial. I was so excited when they talked to me about the Jace case. One of the first things I said was, what about all the people that are going to die in 30 days if the supply chain breaks down? And they said, we're working on it. And I said, when you guys have it, you can come on the show, because this is the one piece of a prepper's job that has not been able to be solved.
Yeah, absolutely. You've got your food, you got your water, but without your health, what do you do?
Just America without its psychiatric meds. The number of depression we have that are killing themselves now, imagine in hard times and no medication. In 30 days, you start to have...
It's terrifying.
Oh, it's
well, and
terrifying.
some of them are life-threatening. Specifically, you're talking about some of the psychiatric medications. Yeah. Those are ones, if you stop taking your statin for your cholesterol, you're probably going to be okay for a bit. You can get back on. You've got some time.
Right.
There's those other medications, specifically in the kind of psych realm and some others, that you can't just stop them cold turkey. There's going to be consequences. And you're right. We just haven't had a viable option to protect yourself or your family.
Protect your family now. Go to jasemedical.com. Find out all about it. Jace, Jase, medical.com. Congratulations. Thank you for solving this.
Well, thank you. I feel like we've got a lot more work to do, and we're just getting started. But
that's great.
This is great. You've been great at helping us get the word out.
You bet. One step at a time. Make sure every step is exactly right. You make one false step, and then we lose this opportunity.
Yeah.
So thank you. JaceMedical.com. That's JaceMedical.com.